Good afternoon, everybody. I'm David Bayada, CEO here at Bayada Home Healthcare, and today is Friday, December 4th, and this is the weekly COVID-19 CEO update. Today, I'm joined, as usual, by Nora Triola, our Chief Clinical Officer, and we're going to jump right in to provide some important updates about our emergency leave funding, the grant program that we have to support all of you out in the field as you navigate all of the challenges with the coronavirus and your clients. Nora, do you want to talk us through this?
Sure. I want you to understand that there's good news here. We have had a program that has been in existence since we started the pandemic, where we provided additional sick leave for anyone that was exposed or became positive while work related. That program was due to expire at the end of December, and we have reallocated funding and will continue that through the first quarter of 2021. So I know there were some questions about was that going to end, and the answer is no. It's there. We've heard your concerns, and we certainly appreciate all that you're doing during this pandemic. And this was a benefit that we felt certain we wanted to continue to support. So we've reallocated funds, and that program will continue. There's a couple of additional nuances to that. And that is, now that we're in sort of a prolonged pandemic, that some of our clinicians, some of you may actually have had an exposure and then several months later have either another exposure or the unfortunate incident where you become positive. We are evaluating as a case by case each of those and awarding benefits for those additional incremental times when you miss work because of the presence of the virus, and you either need to quarantine or isolate. We are again reinforcing very, very heavily the need for appropriate PPE. This is a tool that's going to keep you safe. So we, really are encouraging each and every one of you to meticulously and consistently wear your protective equipment. Make sure that surgical mask is on and that eye protection, either the face shield or the goggles, and that you are, hand sanitizing frequently, and that you are not sort of touching your face or any of those personal protective equipment regularly, so that you don't inadvertently expose yourself. We have always, I think, reviewed these cases and provided benefits where we certainly can, and will continue to do that going forward. So that's the good news about the emergency leave extension and some of the clarifications, David.
Thanks, Nora. I just want to reiterate a sense of admiration and gratitude to all of you out there who are each and every day putting yourselves in really putting your clients' needs above your own, and potentially at the risk of exposure for you and your family. And this program was designed to give you some additional confidence that you weren't also putting your income at risk. And I think we've worked really hard to try and create a fair and appropriate fallback benefit here, and excited to be able to extend it through April. No one could have ever predicted that we'd still be in this pandemic now and that we'd have to do this, but it was really important that we find a way to do it so that you can continue to feel supported and as safe as possible. Again, also want to reiterate, this is all built on the idea that we're doing absolutely everything we can to maintain strict protocol, because the best way to preserve these emergency leave funds are to ensure that we don't use them unnecessarily for situations that could have been avoided. And so I'm really grateful to you all out there, and Maya Angelou agrees that you all are true heroes. And and what you're doing every day to put your clients' needs above your own, to rise to the occasion and answer the call of duty to help your clients stay safe and independent, is, despite the circumstances of this crisis, is truly, truly heroic. And so for that, I'm grateful. It's that time of year when we get to really reflect. And while we're not able to maybe enjoy our family time as much as we would like, it's still really important that we come together and ensure that you know how much you're appreciated. So thank you, and we will see you next week.